When people have low back, hip, or knee pain, it's very common for the pelvis to be out of alignment, which means certain muscles are overactive and shortened, and other muscles are underactive and lengthened. And this will definitely affect performance in a negative way. So what I'm going to do is show you a simple way to activate key muscles to put the pelvis back into proper alignment. And I'm happy to have my friend Dr. Tricia Smith here. You'll see that she is resting comfortably with the head underneath her pillow. That's the first step, is make sure that the neck is relaxed throughout this drill. Now, what you'll need is some type of strong dowel, or you can even use like a PVC pipe. Sometimes a broomstick for this drill is a little bit too weak and can snap, because you're gonna put this between the legs, as Tricia's gonna demonstrate, with the dowel behind the right knee and in front of the left knee at the lower thigh. Now, what she's gonna do here is she's going to activate her hip extensors on the right and her hip flexors on the left. So she's gonna try to push her right knee away from her and pull her left knee towards her chest. This is an isometric contraction, and there's not gonna be any movement. But she's gonna do that for 5 seconds with an effort of about 8 out of 10. Now the key component here when you're doing this activation is that you're exhaling as you're applying the force. Another important component is that her low back stays flat. There's no lumbar extension. So she's gonna do 5 seconds of activation, then relax briefly, and inhale 3 to 5 seconds, and then do another activation for 5 seconds. She's gonna continue that for 5 rounds. Then she will switch the position of her legs. So let's go ahead and take that dowel out. Now it's behind the left knee, in front of the right knee. Same thing, 8 out of 10 effort, trying to straighten her left leg while she's trying to simultaneously pull her right knee back towards her chest. She's exhaling as she's doing this 5-second contraction, and she's keeping her low back flat. And after 5 seconds of the last of the 5 cycles, she'll take this dowel out. And the last component is to take a basketball, put it between your knees, and what she's going to do is another isometric activation drill here. She's going to try to squeeze the basketball between her knees with 8 out of 10 effort for 5 seconds. Again, exhaling as she's squeezing and keeping her low back flat. She'll rest 3 to 5 seconds as she inhales, and then she'll do another 5 seconds of activation. And this will continue for 5 rounds. So to recap, 5 cycles of a 5-second activation with the dowel, with the right leg up and the left leg up, and then with the ball between the knees. And this is a terrific drill that really helps put the pelvis back into proper alignment. And you'll see that when people stand up after doing this drill, they'll often feel less tension in their hips, they'll be more mobile, they'll be able to squat easier, they'll have less knee pain. So I highly recommend you try doing this activation or corrective exercise before squats, deadlifts, and lunges, and I think you'll really see the benefit of it.